Scenario 1. Respiratory distress in an elderly patient. Mrs. Johnson, an 82-year-old woman with a history of hypertension and osteoarthritis, presents to the emergency department with acute onset dyspnea and confusion. She is tachypneic, using accessory muscles, and has bilateral crackles on auscultation. Blood pressure is 160/90ths of a millimeter of mercury, heart rate 110 bpm, respiratory rate 28 per minute, and oxygen saturation 88% on room air. What are the possible differential diagnoses for acute respiratory distress in an elderly patient? What initial steps in management would you take in the emergency department? What investigations are crucial in this scenario, and what findings would you expect? How would you grade the severity of her respiratory distress, and what criteria would you use? What are the potential complications of the condition, and how would you manage them? Scenario 2. Abdominal pain in a young female. Miss Anderson, a 26-year-old woman, presents with severe abdominal pain that started in the epigastrium and has migrated to the right lower quadrant. She has associated nausea and vomiting. On examination, there is tenderness in the right iliac fossa with rebound tenderness. She has a low-grade fever. What are the potential causes of right lower quadrant abdominal pain in a young woman? What is the significance of rebound tenderness, and how does it guide your diagnosis? How would you differentiate between surgical and non-surgical causes in this scenario? What investigations would you order, and what findings would support your diagnosis? Outline the management plan for this patient, including both immediate and definitive measures. Scenario 3. Confusion in a diabetic patient. Mrs. Patel, a 65-year-old woman with a history of type 2 diabetes, is brought to the clinic by her daughter due to increasing confusion and lethargy. Her blood glucose is 480 mg per deciliter, her blood pressure is 150/90ths of a millimeter of mercury, and she is mildly dehydrated. 1. What are the potential causes of acute confusion in a diabetic patient? 2. How would you assess the severity of hyperglycemia in this case? 3. What initial steps would you take in the management of his hyperglycemia and dehydration? 4. What complications are associated with uncontrolled diabetes, and how would you address them? 5. What long-term management strategies would you discuss with the patient to prevent recurrence? Answers. Scenario 1. Respiratory distress in an elderly patient. 1. Possible differential diagnoses. 1. Heart failure exacerbation. 2. Pneumonia. 3. Chronic obstructive pulmonary disease, COPD, exacerbation. 4. Pulmonary embolism. 1. Initial management. 1. Ensure ABCs, airway, breathing, circulation. 2. Administer supplemental oxygen. 3. Obtain intravenous access. 4. Consider non-invasive ventilation if respiratory distress persists. 5. Assess for potential triggers, infection, heart failure exacerbation. 1. Crucial investigations. 1. Chest X-ray. 2. Complete blood count, CBC, electrolytes, renal function. 3. Arterial blood gases. 4. B-type natriuretic peptide, BNP, for heart failure. 1. Severity grading. 1. Use parameters like respiratory rate, oxygen saturation, and accessory muscle use. 2. Apply scoring systems like the Modified Early Warning Score, MUSE. 1. Complications and management. 1. Acute respiratory failure may require intubation and mechanical ventilation. 2. Treat the underlying cause, e.g., diuretics for heart failure, antibiotics for pneumonia. 3. Monitor for fluid overload and electrolyte imbalances. Scenario 2. Abdominal pain in a young female. 1. Causes of right lower quadrant pain. 1. Appendicitis. 2. Ovarian cyst torsion. 3. Ectopic pregnancy. 4. Pelvic inflammatory disease, PID. 1. Rebound tenderness. 1. Indicates peritoneal irritation and suggests a surgical cause. 1. Differentiation of causes. 1. Surgical causes often present with sudden onset, rebound tenderness, and migration of pain. 2. Non-surgical causes may have a more gradual onset and less severe physical findings. 1. Investigations. 1. Abdominal ultrasound or CT scan. 2. Complete blood count, CBC, C-reactive protein, CRP. 1. Management plan. 1. Immediate surgical consultation, pain management, fluid resuscitation. 2. Definitive appendectomy for appendicitis, appropriate intervention for other diagnoses. Scenario 3. Confusion in a diabetic patient. 1. Causes of acute confusion in diabetes. 1. Hyperosmolar hyperglycemic state, HHS. 2. Diabetic ketoacidosis, DKA. 3. Hypoglycemia. 4. Infection. 1. Severity assessment. 1. Assess mental status using the Glasgow Coma Scale, GCS. 2. Measure blood glucose levels. 1. Initial management. 1. Fluid resuscitation for dehydration. 2. Insulin therapy for hyperglycemia. 3. Correct electrolyte imbalances. 1. Complications and management. 1. Monitor for cerebral edema, more common in DKA. 2. Address underlying cause, e.g., infection. 3. Provide education on diabetes management and prevention of future episodes. 1. Long-term management. 1. Optimize glycemic control through lifestyle modification and medication adherence. 2. Regular follow-up to monitor and manage diabetes complications.